Beth Johnson. I'm here to present to you today about coping with compassion fatigue for occupational therapy practitioners. In order to ensure flow throughout the presentation, I will not be reading the authors in the in-text citations. If you would like to know where any of this information was obtained, you can see it in the PowerPoint slide with the in-text citations as well as the references. Prior to taking the course, I would like to ask each of you to complete the pre-course symptom check. When looking at the list of symptoms that you can find at the link here, do you currently experience any of those signs and symptoms of compassion fatigue? Please select each sign or symptoms that you experience currently or that you have experienced in the past 3 months. I would also like to ask each of you to complete the pre-course knowledge test. That'll just give us an idea or be able to gauge your knowledge on this subject prior to completing the course. There are several learning objectives for this course. After completing the course, you will be able to find key terms related to compassion fatigue, including compassion fatigue and burnout. You will be able to develop a self-awareness of the symptoms as well as the factors that lead to the development of compassion fatigue. You will be able to describe the negative effects of compassion fatigue and what it can do to the OT practitioners, the clients, and the organization. You'll also be able to identify self-care activities that can be included in a self-care plan that can be used to combat compassion fatigue. You'll be able to implement coping strategies to prevent and treat compassion fatigue. And you'll be able to design an individualized self-care plan to be used in the future to prevent and/or cope with compassion fatigue. Compassion fatigue is defined as the decreased capacity to demonstrate empathy due to the distress or trauma that a client may have experienced. Compassion fatigue is also known as the cost of caring. It often happens when a practitioner becomes emotionally saturated. And the term compassion fatigue is actually something that began as a nursing term. It was first coined by Carla Joynson in 1992 to reference nurses who were experiencing burnout and who had lost the ability to really nurture their clients the way they would like to. Compassion fatigue includes the emotional, physical, cognitive, and behavioral drain or exhaustion that can occur in helping professionals secondary to the demands of the job. This compassion fatigue makes it more difficult to empathize with clients. The overwhelming amount of emotional energy that is needed to provide care for clients drains the practitioner's stamina. Since the practitioner must also cope with the stressors of their own daily personal life, this combination increases the possibility of burnout and compassion fatigue. In addition, an imbalance may develop that skews the practitioner's focus from their personal life to their professional life, which then reduces their overall quality of life. Secondary traumatic stress occurs when the caregiver or the practitioner observes the anguish of others who have experienced trauma or distress. Oftentimes, the caregiver or the practitioner begins to feel some of the same symptoms as the person who experienced the trauma. For example, after working with a veteran with combat-related post-traumatic stress disorder, or PTSD, the therapist may become anxious in crowded public places, similar to the experiences that the clients have shared with them. Many people use the terms burnout or compassion fatigue interchangeably. However, there is a difference. Burnout typically causes anger, frustration, or pessimism towards other individuals, while compassion fatigue results in sadness, nightmares, and disengagement or separation from other individuals. According to Stam and Figley, burnout can be a contributing factor to compassion fatigue. Compassion fatigue can result in many psychological or emotional symptoms, as well as physical symptoms that you end up having to deal with because of the compassion fatigue. Some examples of those that you'll see listed here: feeling overwhelmed, being disoriented or confused, having trouble concentrating, possibly becoming irritable or agitated, having an increased sense of anxiety, maybe being disinterested or avoiding other people, possibly having difficulty feeling empathy or having relationship disturbances. Then there's also physical symptoms such as shortness of breath, heart palpitations, muscle tension, headaches, digestive issues, fatigue, and sleeping issues, including insomnia. So the signs and symptoms listed on this slide came from a variety of resources, as listed at the end of the slide. These signs and symptoms may impact the practitioner's work performance, resulting in potential absenteeism, diminished work performance, tardiness, and the overuse of sick days. When considering the factors that contribute to compassion fatigue, one has to look at the organizational factors that contribute. Those include increased job demands like productivity requirements, workload expectations, work hours, and caseloads, as well as documentation expectations, high pressure for improved client outcomes, poor or difficult working conditions, lack of supportive supervision, poor wages, and job insecurity. Compassion fatigue is often seen in health and human service providers and other helping professions such as teachers, nurses, social workers, mental health service providers, hospice care workers, and first responders. It's also higher in professions where employees are frequently exposed to negative emotions from their clients. Conflicts between clients and their families is also a professional risk factor for development of compassion fatigue. During the process of evaluating and treating clients, OT practitioners often listen to stories of very painful or traumatic events. These stories bring potential for development of compassion fatigue. OT practitioners give empathy and sincerely engage with their clients. This makes exposure to client experience trauma unavoidable during OT service delivery. There are also individual factors that contribute to compassion fatigue. The prevalence of compassion fatigue is higher in people who closely associate their personal identity to their professional position. Also, practitioners with a greater capacity to provide empathy to their clients are at a higher risk for compassion fatigue. Then there's emotional intelligence levels. Individuals who are emotionally intelligent can manage their emotions more effectively by using coping strategies that increase engagement and decrease stress. Those with low levels of emotional intelligence often utilize unhealthy coping mechanisms, such as avoidance, which increases fatigue and potentially increases stress. Some additional personal characteristics that contribute to the development of compassion fatigue include the ability to process information, the practitioner's ego defensive process, which is that unconscious psychological process that can help an individual cope with some sort of anxiety or negative feeling that they may have resulting from either a stressful internal or external environmental factor. We also must consider the effects of the stress on the individual's ideological beliefs and their coping ability, as well as stress management techniques and personal experiences of the OT practitioner that are related to the trauma being faced by the client. The impact of compassion fatigue may be felt in many different ways. It may negatively impact the practitioner's professional judgment or their ability to provide quality services to their clients. It may cause a lack of attention that's provided to the client, resulting in a decrease in client-centered care, decreased morale within the department, and decreased client satisfaction with the care that's being provided. Compassion fatigue may also be costly to the healthcare organization and may negatively impact overall client outcomes, attrition, and the overall quality of life of the OT practitioner. We have an awareness of what compassion fatigue is, the common symptoms, the contributing factors, and the impact of compassion fatigue. What are the next steps? Finding healthy coping strategies. So the goals of these coping strategies are to develop compassion, satisfaction, and resilience. The ultimate goal is to achieve compassion satisfaction, which is a sense of fulfillment about the work being done by a practitioner that's based on the positive feelings of hope, strength, and resilience. Then resilience can be broken down into 4 components, including proper sleep, healthy diet, regular physical activity, and active relaxation. Resilient practitioners can balance multiple roles and tend to see challenges as opportunities for growth and learning. Developing compassion, satisfaction, and resilience help the practitioner to cope with compassion fatigue. OT practitioners should aim to achieve a work-life balance, enabling them to invest time and energy in caring for themselves. It's imperative that healthcare practitioners find times for themselves each day. Boundaries must also be established. A self-awareness must also exist in order to achieve compassion satisfaction, to achieve work-life balance, and to establish those important boundaries. It is important that we remember that one of the most critical steps in getting help or in coping with compassion fatigue is self-awareness. That self-awareness can be achieved either through an informal daily self-check-in that can be used to just assess the tension in the body, the anxiety in the mind, and looking to see if we're feeling anything that resembles compassion fatigue. Self-awareness may also be achieved using a more formal self-assessment that may help to identify any underlying issues to determine the need to seek additional help. One of the most commonly used tools to assess compassion fatigue and compassion satisfaction is the Professional Quality of Life Scale. You can find this scale at the website below that's linked in the slide. If you would take a moment and review or complete the ProQOL before moving on to the next slide. Once you've completed the assessment, take a moment to reflect on your score. What did you discover about yourself that you didn't already know? Please feel free to pause the presentation while you're doing the ProQOL. Now that you have developed a self-awareness by completing the ProQOL and by learning about the signs and symptoms of compassion fatigue, it's important to think about what you can then do to cope with this. So self-care has been reported as one of the most significant strategies to prevent the development of compassion fatigue. In the upcoming slides, we will further discuss the toolbox that each of you already have in place, as well as strategies you can add to your toolbox to decrease your compassion fatigue and increase compassion satisfaction and resilience. Take a moment to think about the strategies you already have in place and the potential need for more strategies. Please pause the video if you would like additional time to reflect on your current self-care strategies. A self-care plan is something that you can use in order to make sure that you're providing the appropriate amount of attention to your own self-care. A self-care plan should address 6 main areas: physical, psychological, emotional, spiritual, professional, and relational health. Remember, a self-care plan is meant to be a personalized toolbox that may include daily practices such as gratitude and reminding yourself of your purpose. Also, please remember that your self-care plan is supposed to be very unique and individualized. Your self-care plan should also address each of the 4 components of resilience. And remember, those are proper sleep, healthy diet, regular physical activity, and active relaxation. It's important to remember that taking care of yourself is not being selfish. It's impossible to successfully care for others if the practitioner's cup is empty. It's necessary for practitioners to demonstrate self-compassion, just like they provide compassion to their clients. Remember, it's not always productive to always say yes to others while saying no to your self-care. There are many possibilities for activities that you can do for self-care. Those activities can include various types of or categories of activity. So you could do things like working on your diet by establishing a healthy diet or participating in mindful eating. You can work on physical activity or get a massage or maybe even work on your bedtime routine. You can create a self-affirmations list or create a list of things that bring you hope or create a calming space within your environment. You could travel, you could seek counseling, you could even volunteer or spend time with those you love. There are many opportunities for self-care in our lives without too much planning or too much money that would have to be spent even. The self-care ideas here were obtained from a variety of resources as listed here at the end of the slide. There are also work-related self-care ideas that can be completed, such as taking adequate work breaks or taking vacations. Those are important. Completing workshops to help you become better at your job, as well as establishing a support group or a peer support network within your job. You could also request mentorship meetings from your supervisor, as well as giving or receiving supervision. Peer support and gratitude journaling are two options for self-care. With your peer support and your gratitude journaling, those things can occur in person or they can occur remotely. As you can see here, the third bullet is labeled Jamboard. If you feel comfortable, please open that Jamboard that's linked to the slide. To open it, all you need to do is click on the link in the PowerPoint. Once the document is open, if you feel comfortable, you can share some challenges that you faced as an OT practitioner, something you are thankful for, and some self-care activities you currently participate in. That may end up helping one of the other practitioners that complete this course that see the activities that you share. So each of the slides in the Jamboard are labeled with one of those questions to show which one should be answered on that page. Then to share on the Jamboard document, all you need to do is click on the icon on the left that looks like a sticky note. A small screen will pop up. You can choose the color background you want, type your answer on that small screen, and then click Submit. Your response will then appear on the Jamboard document, and it'll look like a little sticky note. I encourage you to reach out to other OT practitioners who understand what you're experiencing, whether it's virtually, like something like the Jamboard, or whether it's via telephone or in person. It's helpful for you to establish a peer support network so that you know that you're not alone. These techniques can be used to bring the individual that's participating into the present moment and makes them self-aware without judgment. A possible coping strategy that can be used in your self-care plan is various types of mindfulness techniques. Oftentimes, people who are unfamiliar with mindfulness techniques think that it takes a large amount of time or that they have to sit in a certain position. However, mindfulness can be completed while doing the very most basic thing, breathing. Mindfulness can also be included in most of your daily activities. It can be completed in a mindful way. For example, you can utilize mindfulness practices while doing a basic ADL, such as brushing your teeth or eating. You could also use mindfulness while walking. Before we begin this first mindfulness practice, I would like to acknowledge that mindfulness takes time and practice. It's definitely not a quick fix. However, it can help you in the long run if you commit to practicing the mindfulness techniques that you learn. So if you're willing to participate in the mindful walking activity, you would take a walk through your neighborhood or on a local beach or whatever location that you prefer. As you're walking, try not to allow your mind to move through other thoughts. Try not to think about your day at work or what you have left to do later. Just notice your surroundings. What do you see? What do you hear? What do you smell? What does the ground feel like beneath your feet? How are you feeling as you walk? Are you out of breath? Are you feeling energized? Do your best to remain fully in the moment, taking in everything around you. In order to participate in this mindful eating exercise, all you need is your favorite snack food, 5 to 10 minutes of your time, and an open mind. I would like for you to begin by connecting your breath and body. Feel your feet on the ground and notice what you are feeling, seeing, and hearing in this moment. With your awareness in this moment, notice any thoughts, sensations, or emotions you're experiencing. Tune into the awareness or sensation that you have in your body. Do you feel hungry, thirsty, or full? If you were going to eat or drink something right now, what is your body hungry for? What is it thirsty for? Be aware of the sensations within your body that provide you with these cues. Now bring your attention to the food of your choice in your hand and imagine that you're seeing it for the very first time. Observe it with an open mind as you pay attention and notice the color, shape, texture, and size of the food. Is there anything else that you notice, sense, or feel as you're looking at it and holding the food? Imagine what it took for this item to get into your hands. Sunshine, water, time, processing, and shipping. You may choose to be aware of gratitude for everyone involved in the cultivation and preparation of this item of food. You may choose to bring in your own gratitude or spiritual blessing. Now place the item between your fingers and feel the texture, the temperature, and the ridges. You may notice smoothness or stickiness. Again, take notice of any thoughts, sensations, or emotions you are experiencing. Continue to breathe and be fully present in this moment. If something else comes into your mind, acknowledge it and then refocus on the item in your hand. Take the piece of food and bring it towards your nose and smell the food. Notice if you have any memories, sensations, or reactions in your body. Even before you eat it, you may notice that you begin to have a digestive response in your body, just by noticing and smelling the food item. What, if any, are those responses that you're noticing? Now feel your hand going towards your mouth. Are there any thoughts that happen while completing this movement? Place the food into your mouth without chewing or swallowing it. Just allow it to be in your mouth. Roll it around to different parts of your mouth and tongue. Notice the flavor and the texture. Notice the physical sensations within your body, especially your mouth and your gut. Be aware of how having this item in your mouth is making you feel. How is your body responding? Next, take just one bite and notice the flavor. Notice the change of texture. Then very slowly, begin to chew this piece of food. And notice the parts of your mouth that are involved in the chewing. Notice the sound and the movement of the chewing as you continue to notice the sensations and flavors. When you're ready, swallow this item and notice the path that it follows from your mouth and throat into your stomach. Notice the sensation and taste that may linger in your mouth. Connect again to your body and your breath and notice your experience in this moment. Next, I invite you to take another bite of your chosen food item. This time, eat it however you wish. Notice how your choice in how you eat changes your experience. Notice how it's similar or different. How did the mindful eating exercise feel? Did you relax? Did you enjoy your food more? Describe your experience in a few sentences. Take a moment and think about that. Do you feel you could use this technique regularly as a part of your self-care plan? In addition to the role that you play in combating your own compassion fatigue, there's also a role that the supervisor plays in preventing and coping with compassion fatigue. An increased awareness of the signs and symptoms of compassion fatigue will allow supervisors to provide timely support and provide the knowledge needed to appropriately modify organizational factors that lead to an increase in compassion fatigue. Supervisors may use strategies to prevent compassion fatigue amongst their staff members, including scheduling regular meetings where staff members can voice their concerns and experiences, utilizing regular training opportunities, peer support groups, and encouraging staff to take appropriate breaks. There's also a role that the organization can play in preventing and coping with compassion fatigue. The organization can provide activities such as art therapy, massage sessions, tranquility rooms, and reward and recognition programs. I would like for you all to meet Frances. Frances is an occupational therapist in an inpatient psychiatric facility. She provides individual and group OT treatments in this facility. She often hears and reads stories of domestic violence, abuse, and other traumas her clients have experienced. Frances has started to notice she's having difficulty concentrating at work. She's irritable, and the anxiety she thought she conquered a few years ago has started to return. She has muscle tension in her shoulders and is dealing with insomnia. She's noticing that it's harder to feel empathy towards her clients. Currently, she's feeling unfulfilled at work and often feels alone in her struggles. Recently, the rehab director has met with her to discuss her recent increase in using sick days. Based on the information in the case study, do you think Frances has compassion fatigue? What symptoms is Frances exhibiting that leads you to believe she has developed compassion fatigue? Take a moment to think about that. Let's talk about some of the symptoms that Frances is demonstrating. She spoke about having difficulty concentrating, being irritable, having anxiety, having a harder time showing empathy to her clients, feeling unfulfilled at work, having muscle tension and insomnia, and having to use an increased number of sick days. So what coping strategies do you feel would be best for Frances? Maybe we could suggest meditation practices to help with sleep, or possibly suggest an exercise routine. Maybe we could look at her sleep schedule and see if we can help there. Or maybe we could suggest gratefulness practices or a group of OT peers that she can discuss her feelings and thoughts with from work. To increase the awareness of compassion fatigue is crucial in executing future programs meant to reduce compassion fatigue. An awareness of the various challenges and barriers that exist or that are encountered by OT professionals will better inform employers and managers regarding how to improve their working conditions and increase compassion satisfaction. As many of you already know, many organizations we work for often do not allow the space or time needed for mindfulness practices during the workday. I believe there is a need for an organization-level change. Perhaps we can use this opportunity as a call to action to bring awareness of compassion fatigue and the appropriate strategies organizations can use to ensure healthy practitioners. Practitioners are often bogged down by the system. They're worn out and overwhelmed by their workload. According to the preliminary findings from Hahn and Popova, practitioners who perceive their employers as prioritizing their health and wellness reported lower scores on the perceived stress scale and higher scores on the professional identity questionnaire, the professional quality of life questionnaire or survey, and the World Health Organization Wellbeing Index. On the PIQ, practitioners reported a clear understanding of the OT's role and values. So our call to action here has to do with the employers that we work for. So when employers prioritize the health and wellness of their employees, that may mean things like providing them with time and space to participate in mindfulness exercises while at work or on a break. That may also include recognition for the employee's hard work. The activities that you include in your self-care plan are completely up to you. This is a self-care plan that should be unique to your needs. It also needs to be something that you'll be able to stick with. So making it overcomplicated or including too many expectations of yourself may have a negative impact instead of a positive one. Take a moment to reflect on each of the self-care activities and coping strategies that has been discussed in this presentation. What activities would you like to include in your personalized self-care plan? The next slide will provide you with several self-care plan templates. However, there are plenty of templates that can be found online, so please keep in mind that the ones on the next slide are just for an example. I would just like to point out that you can be as detailed as you would like to be with your self-care plan. You can use any type of format that you're comfortable with using, and you can formulate the plan to be specific to you. So you want it to be unique to you. I've provided examples of 3 different types of self-care templates below. The first one is a basic mind, body, and soul self-care template to be completed in a very basic table. Then the second one is the self-care wheel. So that comes with an example to show you how the self-care wheel may look once it's completed, and it also offers a blank self-care wheel. The third option is simply a narrative self-care template where you can just write down your ideas based on answering the prompts on the page. There are quite a few additional resources that you can utilize to further your knowledge in this area. The Greater Good in Action Science-Based Practices for a Meaningful Life through berkeley.edu is one resource that you can check out. There's also the ProQOL website. So this particular website link will take you to the ProQOL site itself and not just the assessment. So the assessment URL is in the PowerPoint slide for the self-assessment. But this is the general website so that you can also see the various self-care tools that they have on the ProQOL site. There's also mindfulness resources you can utilize from freemindfulness.org, as well as 22 mindfulness exercises or activities for adults through positivepsychology.com, and mindfulness exercises through the Mayo Clinic, as well as some mindfulness apps. One's called Calm and one in the Moment. However, there are plenty more out there. These are just 2 I chose to speak about. And then there's additional self-care activities or ideas that can be found at this link here through learningtobefree.com. If anyone has any questions, please feel free to email me at hejohnsonot@gmail.com. There are quite a few references included in the 2 reference slides. For those of you who are interested in completing additional research on this topic, please feel free to utilize the links available for most of the references for a more detailed review of that information. This second slide will show you the remainder of the references that were not on the first reference slide. For the post-course symptom check, do you currently experience any of the following signs and symptoms of compassion fatigue? Please select each sign or symptom you experience currently or have experienced in the past 3 months. Then I would also like to ask if you would please complete the post-test knowledge test, which will gauge the knowledge that you've gained from this course, and also if you would complete the participant satisfaction questionnaire, which will give me an idea of if the course accomplished what we aimed for it to accomplish and if you were pleased or satisfied with the information you received.